and inserts onto the greater tubercle of the humerus, specifically at its inferior facet. Functionally, it's responsible for externally rotating the arm and helping stabilize the shoulder joint by keeping the humeral head in place within the glenoid cavity. It's innervated by the axillary nerve C5 and C6, which stems from the posterior cord of the brachial plexus. This connection is key when we talk about pain referral patterns and potential dysfunctions. The teres minor works synergistically with the infraspinatus to externally rotate the arm, while the antagonist, the subscapularis, does the opposite by internally rotating the humerus. Certain activities can aggravate the teres minor. Repetitive overhead motions, like painting, pitching, or even excessive yoga, can strain it. Likewise, prolonged shoulder tension, such as carrying heavy bags or maintaining poor posture while typing, can lead to dysfunction. When irritated, the teres minor can mimic some serious conditions. Trigger points in this muscle can refer pain deep into the posterior deltoid, down the lateral arm, and even sometimes into the wrist. Because of this, it's often mistaken for rotator cuff tears, cervical radiculopathy, or even thoracic outlet syndrome. So what can you do if this little muscle is causing you discomfort? Here are a few self-help techniques. Trigger point release using a lacrosse ball or massage gun against a wall. Focus on the lateral border of the scapula. Stretching exercises like the crossbody shoulder stretch or the sleeper stretch to maintain flexibility. Strengthening work using light resistance bands for external rotations to build resilience and prevent imbalances. Baseball pitchers often have an overdeveloped teres minor because of the constant external rotation demands in their sport. This can lead to muscle asymmetry, which is why cross-training is so important for long-term shoulder health.
Teres minor causes external rotation and also helps provide stability for the glenohumeral joint. So to do a bit of pin and stretch on it, we put the arm into external rotation. I'm going to find the muscle. We're going to pin it down. The patient is going to internally rotate, and we're going to also cause a little bit of flexion, so arm going up that way to allow this tissue here to get a full stretch. So two-part move, external rotation, I hold, we reinforce, patient goes in internal rotation, arm goes up all the way, all the way, all the way. Perfect. And we're getting that release through that muscle right there. Perfect.